execute a baby.
Your life is a lie. You don't care if women die.
There has to be some form of punishment.
For the woman.
Yeah, there has to be some form.
Not your body that you're murdering.
Prohibit the late-term abortion.
Stop interfering with women's private health care decisions.
All of
this
that.
is a sham.
Evidence-based medical care is important.
To make sure that they don't die on the abortion table, to make sure that they aren't butchered by abortionists.
How often is surgery and sort of cutting involved when there's abortion?
I'm not a medical student.
Despite what 73% of pollers responded, the vast majority of abortions aren't surgical at all. In fact, abortion is probably way simpler and way safer than you think it is.
And how safe is abortion?
I haven't got a clue.
There's a new report out today on abortion safety and quality in the United States. It comes from the National Academy of Sciences.
Ned Kalange is the co-chair of the committee that wrote this study.
I would say the main takeaway is that abortions that are provided in the United States are safe and effective.
There are two categories of abortion procedures: in-clinic and medication. The abortion pill is usually the go-to method for the first 10 weeks of pregnancy, and after that, women generally have to look at in-clinic options, though most abortions occur at 8 weeks or earlier. It's not complicated at all. First, the woman takes mifepristone, which blocks hormones in the body to stop the pregnancy from developing. 1 to 2 days later, she takes misoprostol, which induces cramping and bleeding, much like a heavy period, to empty the uterus. A week or two later, the clinic will conduct a blood test or an ultrasound to check that everything went as planned. The process generally takes just 5 hours and is incredibly similar to what someone going through an early miscarriage might experience. In-clinic abortions, on the other hand, or sometimes called surgical abortions, are necessary for abortions that occur after the first trimester, but only about 11% of abortions are performed after those 12 weeks. Surgical abortions are probably a lot less gruesome than you're imagining. While it's certainly a more serious procedure than the pill, it's still very common and very safe. Most, about 95%, of in-clinic abortions use the method of dilation and evacuation, or D&E. The medical professional performing the procedure uses gentle suction through the uterus to pull out the tissue and sometimes other medical tools. During this time, women are given medication for the pain. For most women, the procedure just feels like strong period cramps and will find their body recovering within just a few hours. So if most abortions are safe and simple, what do laws that regulate abortions in the name of safety actually do?
Kalange is a family practitioner and professor of medicine at the University of Colorado in Denver, and he says complications are extremely rare. One of the biggest barriers to safe abortions, he says, are state laws and regulations that have no basis in medical research.
The 1992 Planned Parenthood versus Casey ruling that said states can create restrictions as long as they don't place an undue burden that places a substantial obstacle in the path of a woman seeking an abortion. Meaning women can be asked to jump through a few hoops, just not too many.
There are some requirements that require clinicians to misinform women of the health risks.
The state requires me to tell you that if you're having an abortion, there's the possibility of having complications. There's the risk of bleeding, there's the risk of infection, there's the risk of damage to any of your organs. But guess what? Those are all the exact same risks from continuing a pregnancy and going to term. The final thing that I have to tell you that I don't agree with, but I have to tell you anyway, having an abortion can increase your risk for breast cancer. There's not a shred of scientific evidence to prove that. They can require me to tell you the first part, but they can't stop me from giving you my best medical opinion, and that is that there's no increased risk for breast cancer from an abortion.
And it hardly stops there.
More than half of all American women live in a state with 4 or more types of restrictions on abortion.
A multitude of abortion laws devoid of science exist all over the U.S. Let's look at the laws that dictate when abortions are legal. Most states place a gestational age limit on when abortions can be performed after the first trimester. This means after a certain number of weeks pregnant, the state will no longer allow a woman to abort her fetus, unless, of course, her health is at risk. For many states, this cutoff is around 20 weeks. To put that into context, most pregnancies last around 40 weeks. In a country where abortion has to be legal to some extent, you would think that 20 weeks would have to have some sort of significance to be the cutoff point. Well, it does, sort of. See, the idea is that around 20 weeks, the fetus can start to feel pain, which would make perfect sense to be the cutoff point, if it had absolutely any concrete evidence to back it up. The idea that fetuses can start to feel pain around 20 weeks is quite common and often treated as a hard fact. But all of the evidence points towards fetuses having absolutely no ability to feel pain at this point, as fetuses don't develop the neurological wiring required to feel until at least 24 weeks. And another prominent study on the subject in 2005 didn't put the fetus's ability to feel pain until 26 weeks. Another study put this number at 29 to 30 weeks, making the 20-week cutoff point completely arbitrary. Should a woman who was going to get an abortion at 19 weeks but was delayed be denied all the options she had just days ago? Maybe that's unfair, or maybe that's just the state's right to legislate. And to be fair, 20 weeks sounds like a lot. That's half the average pregnancy, which seems like it should be plenty of time for a woman to make her choice and get her abortion. But the key word is should. State laws are making it increasingly more difficult for women to get abortions in a timely manner. In fact, one poll found that more than half of all abortion patients wished that they could have obtained their abortion earlier.
There are policies that mandate clinically unnecessary services like pre-abortion ultrasounds, separate inpatient counseling. There are required waiting periods.
Those mandatory waiting periods, which can range from 18 hours to days, happen between pre-abortion counseling and the abortion itself. It might not sound like a big deal, but regulations add up.
27 states make women wait at least 24 hours for an abortion, and 11 require women to have an ultrasound before they can terminate their pregnancy, according to the Guttmacher Institute, which does research on reproductive health.
Some states require in-person counseling, but by design only have an extremely limited number of abortion providers in the state. This means some women have to drive for hours to get to the nearest clinic for the required counseling, only to be told she has to wait 3 days for the procedure. Because of their waiting periods, 14 states essentially force women to take 2 trips.
Restrictions have made abortion essentially inaccessible. Women in Rapid City, South Dakota, for example, have to travel 318 miles to the closest abortion facility.
Not every woman has the time to spare, especially considering that 49% of women who receive abortions fall below the federal poverty line, and another 26% are considered low income. That's 75% of all abortion patients. Lower income women tend to have a lot less flexibility than women who are middle or higher income. Missing just a few days of work can mean not having the funds to put food on the table or getting fired. And it's worth noting that experts agree that these waiting periods have absolutely no medical reasoning, making them purely a dissuasion tactic that can severely impact a woman's access to abortion.
I told her, you can come to San Antonio, we can help you here. And she said, I can't, I don't have the means, there's no way I can get to San Antonio. So what if I tell you what I have in my kitchen cabinet and you tell me what I could do?
There are state laws that dictate who can perform abortions and where they can do them. Donna Harrison is the executive director of the American Association of Pro-Life Obstetricians and Gynecologists. She says abortion should be treated like other surgical procedures, with lots of oversight and regulation.
The tendency to look at abortion as though it were not a serious medical procedure is irresponsible.
It might sound reasonable to want the most qualified person doing medical procedures like abortion, but in reality,
nurse practitioners and physician's assistants can perform abortions just as safely as doctors.
Laws that require overly qualified professionals often go hand in hand with those that require unnecessarily advanced facilities.
Some require all abortions to happen in the equivalent of a hospital or surgery center. Others require a doctor to have admitting privileges in a nearby hospital.
Now, hospital admitting privileges and high building standards sound great until you realise what they actually mean.
Again, why it's going to be shut down? Because this isn't wide enough?
Yeah, because right now the walls that we have, they're about 3 feet wide, and to be an ASC, it has to be 8 feet wide.
Those sorts of laws have been totally debunked.
That's Hal Lawrence, the CEO of the American College of Obstetricians and Gynecologists. He says the National Academy's report shows that most of those laws do nothing to improve women's health, and many of them just end up delaying when women get an abortion.
Defenders of these laws will say they have a simple purpose.
This is really about the issue of women's health.
We're protecting women's health and safety.
We are protecting women's health.
I just wanted to reiterate that this is really all about protecting the health and safety of women.
Abortion is safer when it's performed earlier in gestation. And so delaying and making people wait and go through hoops of unnecessary extra second procedures does not improve the safety. And actually, by having them delay, can actually worsen the safety.
The Supreme Court in 2016 voided some state abortion laws when it ruled that Texas's strict rules around abortion facilities impose an undue burden on women. But other laws remain in place, even without any backing in medical research.
Severe legislation without a shred of evidence to back it up is a problem, but at least it's no wonder why no one seems to understand abortion for the generally safe procedure that it is.
Many women in Texas and other places around the country have been hurt in abortion facilities that aren't up to basic medical standards.
I mean, I don't know like a specific number, but a lot.
And the states aren't the only ones with power. The courts are currently debating the legitimacy of Trump's newest anti-abortion action, changes to the Title X program. Title X is a federal grant program that was designed to help fund family planning clinics. But President Trump proposed changes that would make any clinic that offers abortion referrals or shares office space with a clinic that does ineligible for the program. Many pro-abortion advocates have denounced these changes as the gag rule that effectively keeps doctors who work for publicly funded facilities from giving their patients seeking an abortion the information they need.
What President Trump is doing is to put a gag on doctors like me to prevent us from providing our patients with full and accurate medical information. So if you are a woman who goes to a health center that receives public funding, you cannot be referred to abortion care, even if your life depends on it. It only does one thing, which is to restrict patients' access to reproductive health care. It has no basis in medicine or science, and the only effect is going to be preventing 4 million Americans from receiving basic health care, including breast and cervical cancer screenings, affordable birth control, and STI tests.
That's Lena Wen, the current president of Planned Parenthood, who's also a licensed medical professional. But not everyone shares her point of view. NPR interviewed one pro-life advocate who saw the changes to Title X as a positive.
It's absurd that it's called a gag rule.
We should note that federal funds were already barred from paying for an abortion. So what else will be banned here exactly, as you understand it?
What we're doing is protecting the consciences of people who don't want to be complicit in the Abortion Act. And that is the taxpayer every single time Planned Parenthood uses this money for its overhead and its counseling, its support, and referral for abortion.
I want to make sure I understand what you're saying here. You're saying, well, they can just raise money for abortions some other way. But they already do that. They already have the abortions paid for separately. This is reaching beyond whatever abortion services might be provided to any other service that the facility provides and saying that abortion cannot be discussed, or if a doctor or some other healthcare provider thinks that that might be an option that the person ought to consider, they can't even refer them in that direction.
No, that's not it at all. All this does is put a bright line of separation between what family planning is, which is not abortion, and contraception and all those other services that Planned Parenthood does. This is what this is about. It's about the conscience of taxpayers, and it's about Planned Parenthood respecting the integrity of the family planning, not abortion program.
However,
over 100 medical and public health organizations oppose the gag rule, including the American Medical Association, the American Nurses Association, and the American College of Obstetricians and Gynecologists. Title X is our nation's program for affordable birth control and healthcare. And this program is intended to ensure that people with low incomes who live in rural areas or who don't have health insurance still have access to cancer screenings and preventive care. It will disproportionately affect those who already face the greatest barriers to care. It's women of color and families with low income.
Religious groups say that they feel like they too deserve these funds so that there isn't a monopoly on care.
Look, I'm a doctor and a scientist, and I need to do what's best for my patients based on medicine and science. And what we have done for nearly 50 years through Title X is to follow the best available medicine and science. Title X is recognized to be one of the most successful public health programs in reducing sexually transmitted infections and reducing unintended pregnancies. This is what works.
So, to summarize, abortion is, in the majority of cases, extremely safe and fairly simple. Most Americans aren't aware of this and peg abortion as far riskier than it really is. Many states capitalize on these misunderstandings by enacting legislation in the name of women's health with zero medical basis to dissuade, restrict, and decrease access to abortion services. These laws that make getting an abortion more difficult only end up making abortion more dangerous than necessary and unfairly target lower-income women. Many Americans believe that these laws are for the sake of women's health, but clearly many of them are anything but. Everyone has the right to decide for themselves when they think abortion is right or wrong or when the lines are crossed. But how can anyone do that when they're relying on conjecture and fake science? Abortion is a serious decision for millions of women. In fact, up to a third of women will get an abortion in their lifetime. Though of course many Americans far underestimated this statistic when polled. So the least we can do is understand what abortion truly is and how legislation truly affects it.
Because of this crazy law, it is impossible to find people to work for us. She's 13 years old, and she is a victim of rape, and she drove 4 hours from McAllen to San Antonio, and we had to turn her away. And there was nothing I could do to save her. And so now, if she has a procedure, and that if is huge, she'll have to go all the way to New Mexico and pay $5,000 and get there and spend 3 days. It'll never happen. We know it won't.